some of you may remember in February of this year, we had a group of CHI members and CHI leads come and talk with us about their legislative priorities for the year. So we talked with folks in childcare and early learning, talked with housing, homelessness, hospitals, behavioral health care. Today, Senator Short, when she comes on, will be talking to us about some of the Senate bill updates. So Senator Short is closely familiar with those and less familiar with some of the House bills. But I did just want to refresh you all on some of the priorities. These also came out to you all in a long PDF to explain each one of the bills. High up on the list was a child care bill that assisted children with transitioning to kindergarten. A second one was about housing and modifying low-income home rehabilitation programs. At the heart of that was increasing the amount of money that can go towards home weatherization in places like Okanogan County. A second one was increasing the supply by modifying real estate excise taxes. So all of that funding would have gone directly into housing and could have been applied to anything that pertained to affordable housing. A fourth one was about moving forward Washington State's ability to pass a $4 billion bond to address affordable housing and homelessness across the state. So Senator Short will be able to talk with us about the status of that as well. We also heard from other CHI members about hospitals. So some of these were legislative bills and some of these were about moving forward a package of legislative initiatives. The first one was more payment to acute care hospitals for difficult to discharge Medicaid patients. I'm sure that sounds familiar to many of you on the call. Not a lot of explanation for why that might be important. So similarly, there was lots of different pieces of legislation connecting to address the crisis of difficult to discharge patients. Protecting patient safety. So this came from one of our local hospitals to really look closer at staff ratios and how that might affect local healthcare systems. And lastly, behavioral health. And that was about contracting and procuring requirements for behavioral health services. So Senator Short has joined us, which is fantastic. We'll send this out to you, this little legislative summary. Again, these were not necessarily the CHI's priorities. These were just what a few of our issue leads and some of the leaders within the CHI network had considered to be big priorities for their organization that they shared back out with you all. So I will stop my screen share and say, Senator Short, welcome to our CHI meeting.
Thank you so much. It's good to be here with all of you today.
We are so happy to have you and really looking forward to talking with you. So I know we just have about 15 minutes of your time today. On the call with you are community health providers and leaders from all over Okanogan County. So
Nice.
Housing, childcare, hospitals, behavioral health, social services, parent support, substance use, an extraordinary network of people who are coming together to really think about ways that we can work collaboratively to upend some of these bigger health disparities that continue to persist in Okanogan County. And in February of last year, a group of these folks we invited to come and talk with us about what big legislative issues and priorities were on their radar. Now that we've come past the end of the legislative session, and hopefully you've had a bit of a breather since that actually came to an end, we're so excited to turn the microphone over to you and talk with you about what legislative initiatives actually did pass or didn't pass that you think will influence the health of Okanogan County this coming year. And I encourage our CHI network, if you have questions, to put them in the chat and I'll make sure that Senator Short can read them. So
that sounds great, Elena. I just came in on the last piece of the presentation, so I don't know if you want me to go over, those issues again, because I certainly do have the status of all of those. So it's up to you how you would like me to do this.
The big elements or the big issue areas that the CHI spent a lot of focus time on last year were childcare, housing, behavioral health, substance use, and hospitals. So if we can pick out those individual bills, which would be great, but if there are additional bills or other within that area of issue that you think really helps our network get up to speed or learn what they need to know about what's coming up.
Sure. I can do that. That's great. Just thank you so much for what you all do and for how you help Okanogan County. Love the county, love the people who live there, and know that it's a significant challenge to provide, to make sure that people have healthcare, to make sure that people have, housing and childcare and all of those things. And I will say for the session, there was significant, really, just significant things put forward in certain areas and not in others. And I'm going to discuss them both because I think there's definitely more work to be done in some of these areas. So I'll just start, number one, on the hospital side, clinic side, behavioral health, those things. The biggest one, well, two big issues for the hospitals, and you may or may not have talked about those. 5103 was the difficult to discharge, patient bill, just the Medicaid reimbursement, just the challenges that present hospitals when patients no longer need that medical care, but they're not quite, to a point where they can be, released from the hospital on their own. That bill was signed into law, which is a really good thing. So there was a lot of work done on that issue. The second one is the hospital safety net, which is a payment model that we've seen, in years past to help bring in federal funding. We know that COVID was a really large impact to our hospitals, especially our critical access network. And really what we don't want to do post-COVID is to have less hospitals, to have less care, we know. And so this was a big deal. That starts January 1st of 2024. Staffing's a huge issue, both from, the nurse's point of view, and then also was really excited that we saw the nurse compact signed into law, which is really good too. And that is one where it takes effect the July this month. And then but the licensing piece gives the agency time to implement those rules. So you won't see the licensing part until probably October. But those are really, they're really key. One I wanted to talk about on, just a second, I'm looking at my notes because there were a lot of different things. On the BHO behavioral health front, obviously there was an increase in payments. We know that there is more to still be done, but it's just, it's such a huge thing, to have that local presence for people who are struggling, with mental health, challenges and substance use disorder. And so there's going to need to be more there. But I was glad to see that. Biggest challenge right now is with inflation, is everybody's feeling it. So even with the increases, it's still leaving a lot of you struggling. And I realize that. So I think there is going to be more work done. I would say, in the coming session. One couple of bills that are just what I would say single, issue bills, there were two pieces of legislation that was really designed to improve maternal health outcomes, both for moms and babies, especially where substance abuse, was at play. That bill did not get through the session, but it'll be alive for next year. What that would essentially do is allow for additional days in the hospital, both for moms and babies. I think that's a good thing. We know, we see it in our communities as, these children are born, with challenges to their system, and moms too. I mean, we want to be there to support their challenges as well. So I think that bill will more than likely get through next session. Let's see, 5581 is one that was signed into law, and that would work. That directs the Office of Insurance Commissioner to work with stakeholders, your insurance providers and others to put forward how they're going to eliminate deductibles and things for maternal care. We know that a lot of people don't come in and get help because they have those really expensive deductibles. And so the bill would essentially put them in the same room and put together how they're going to do that. So I was excited about that. One I wanted to talk about in the home care realm, which is really huge. We know that there are barriers to becoming home care aides. We know that testing, where those sites are available, and even the language with which, is their primary language, is a huge barrier. 5278, what Senator Linda Wilson put that forward, and really excited that takes effect this month. And so what it's going to do is it allows individuals to take these tests in their preferred languages, which I think removes a huge barrier. And local testing sites, where can those be? Who can they be? Who can administer these tests and training? So what we see is like, an increase in the availability for people. It's been a huge issue. We know home health care is a huge issue, especially in our rural communities. So I was excited about that. We have more work to do. Well, one, I want to talk about, this is in the housing arena. Just hang on a minute. I had it written down and then it disappeared. Let's see. So House Bill 1250, which is the low income home rehabilitation program. This is a huge deal for lower income housing, was signed into law, which I'm excited about. And it takes effect July 1st. That's a huge deal. And in the housing front, there's more work to be done. The partnerships, there were several bills that went through our local government committee about how do we allow more houses to be built, on property, and all of, and just reducing those barriers. And a lot of those bills, were signed into law. And of course, may not really apply to our smaller counties. But certainly, housing in Okanogan County is affected by, housing supply all across the state. So I think if we can eliminate some of those things in our larger areas, that helps, but certainly more to be done. Childcare, huge issue. I will say from a budget standpoint, and I can get back to folks, I was looking at the ECAP budget, the rates, the slots, and the working connections. I believe there was increased funding, but the budget chart that I had just gave the number, not what was like funded, in the supplemental budget versus this budget. So I need to check in on that. I'm not sure. I think childcare is one of the single largest issues. It's just huge. I don't know how moms and dads and families do childcare and do their jobs. And I know that right now, as we speak, there is a legislative group that is basically doing a tour around the state, both in rural and urban areas, working with childcare providers, just to identify. It's a huge issue, and one that you can't easily point to, the solution. And so I think that is an issue that didn't see as much work as we would have liked. And I think part of it is just like, which direction do you go? And it's not one direction. It's how do we start expanding access in our communities and making it feasible. And so I think that's going to be a huge issue next session. Stay tuned for that. Let's see, obviously the dental, I've got the bill number, but I didn't write down, that was the dental therapy, putting that into law to start that 1678. That starts January 1st of 2024. It was signed into law. And the behavioral health contracting bill, House Bill 1515, that was a big piece for behavioral health. That was signed into law. The hunger relief bill was signed into law. That had an emergency clause, so that's already in effect. That was House Bill 1784. And 5561 is the Law Enforcement Community Engagement Grant Project. That was signed into law, and that takes effect July 23rd. And I know those were bills that you had on your list. But, just honestly going forward, I worked on a bill. It did not get through the legislative process. And this is on pharmacy medications and costs. The PBMs, the pharmacy benefit managers, Senator Cooter and I were working on that bill, and it was designed to really to regulate them in their own chapter of law, to give, to help both the pharmacy and the patient with, we all hear those stories where people are on one drug and then all of a sudden they want to change the drug, even though the person's, the patient is doing well with what they're taking. And there's just an inordinate amount of control that they have. We're seeing it nationwide. We're going to bring the bill back, maybe in a slightly different form, but it's out of control and it's impacting how providers, help their patients, the cost to patients, just our rural pharmacies, actually pharmacies, whether you're rural or urban. And so it's a huge issue, and I've been really honored to work with her on that. So stay tuned. We'll be working on that again. But I think, let's see, I've got housing, substance use disorder, hospital. So I don't know if I've covered everything that you want me to cover. Certainly happy to take questions. And if there are things you'd like me to follow up with, super happy to do that as well.
Thank you so much, Senator Short. That's incredible. I'm so impressed and appreciative of your preparation and looking through the bills that this CHI network has talked about, and also digging into some of these bigger issues. Just a quick note from the chat. Someone is, Aspen is just reflecting how big of a challenge childcare really is all across Okanogan County, and sharing the challenge of paying for childcare in just the small town of Twist, especially when you have to go to a private provider. So really appreciate your note on the important and big work of childcare up ahead. I have one specific question for you, because we are going to talk about this just a little bit today, and I know that we're almost out of time. And that is the Blake bill and the Blake bill fix. Is there any sort of brief reflections or updates that you want to share with us that you think might help us frame our conversation? We have someone from the University of Washington coming later today to talk, later in this meeting, to talk with us about it, but I'd love to hear your 2 cents.
Sure. The biggest thing, we didn't feel as the legislature that drugs should be decriminalized. But on the other hand, it's important for people who struggle with substance abuse to have options and to have access to services, to programs. And what I believe this bill did was really connect have a framework to connect individuals who are struggling with programs, but with follow-up and responsibility, on their end as well. The bill itself essentially, put these charges to gross misdemeanors. Did I say that? Yeah, I did say that right. Man, I'll tell you what, that was one of these bills where it went away and then it came back during special session. I think for me, the programs are going to be really key, not just the funding of them, but the funding of places where they can get help. I mean, it's touched our family personally, and you see the struggle, you see the cycle of what drug addiction does and how easy it is to fall back, into drug addiction. And so we know that this is a start. We know there's a lot of work to be done to help local jurisdictions, the court system, have what they need. I've heard from prosecutors, heard from, defenders and things like this about how do we make sure, because it goes from superior court to district court. And so there's going to be that work needed as well, from a programmatic standpoint, to support what local governments are going to need, to process this. But on the treatment end, I think that this is only just a start. Because there is going to need to be tremendous increase in both services and outpatient, inpatient settings. And so for our rural partners, I mean, you all are on the front lines of this, whether, behavioral health, law enforcement, community organizations, housing, all of it. And so I think that's going to be the biggest work that, much like, just the childcare piece, that we are not done. We reset a framework, but there's going to be a lot of work that's going to need to be done. So for people in our communities that are struggling, it's not just pointing them to a program, it's actually having programs where they can decide for themselves, this is a good fit, or this is something that I need. And I will say there was a lot of discussion on how to balance both the need with the responsibility. And I personally think, the bill didn't do everything maybe I wanted to see, but I felt like it had that balance, and the compassion. And now we need to make sure that there are, again, the programs. It doesn't work if people don't have places they can go to seek treatment. And so I think that's going to be the biggest challenge that we have to do for years to come, which is to make sure that that system is in place so people can get help when they want it.
Oh, thank you so much, Senator Short. I also just can't reinforce enough how well you have set up the rest of our CHI meeting and our conversation, which is largely about when we have a technical problem and when we have a complex problem. And substance use is a complex issue. And sometimes
it really is.
We need legislation along the way in order for us to tackle the complex issues. Sometimes it fits perfect, sometimes it doesn't. But we often gain along the way, no matter where it goes. So we're going to talk a little bit about the Blake bill and how it brought to the surface some of these big questions that you just brought up about long-term treatment and community investment.
And I would just share, your group is such a great resource. And as you start talking through these things and identifying, if you want either Elena or others to follow up with me, so I better understand the discussion you guys have had and where you think maybe things need to go, that would be really helpful for me.
Oh, I just wrote it down. That is a tremendously appreciated offer. So thank you. Thank you.
Thank you.
I know that we are at time with you. So thank you so much for giving your resources today to come and join us. Of course, you are welcome to stay and join us for as long as you would like to at this meeting, but we are just very, very grateful for your time today. Thank you
so much. Thank you, everyone. And I appreciate so much what you're all doing for our communities in Okanogan County.
Thank you, Senator Short. We'll follow back up with you.
Okay, sounds great. Thank you.